All right, chapter 28, hematologic and renal emergencies. So, the hematologic system, blood, representing its own organ system, has specific functions: control of bleeding by clotting, delivering of oxygen to cells, removal of carbon dioxide from cells, and removal and delivery of other waste products to organs that filtrate and remove them. Made up of solid components, red blood cells, white blood cells, platelets, and they are suspended in plasma. Medications can affect some components of blood. So blood clotting. Aggregation of platelets is body's most rapid and initial response to stop bleeding. Clotting factors are a group of proteins produced in liver and released into the bloodstream. Once activated, clotting factors form clots through clotting cascades. Coagulopathies. Abnormal clotting of blood can occur when body forms clots too readily or patient clots too slowly. Certain diseases make patient prone to poor clotting. Those are advanced liver disease, hemophilia, and von Willebrand disease. Identifying patients with coagulopathies. Certain medical conditions in which the normal ability to form clots can worsen patients' disease. Patients are prescribed blood thinners, more prone to have life-threatening bleeding when injured than patients not on these medications. So those questions are, when you have somebody that's bleeding or has fallen, are you a hemophiliac? Do you have von Willebrand disease? And I know a guy in Kit Carson that does. And then questions, are you on blood thinners? Do you have a blood clotting problem? Are always things we ask when somebody has been in a trauma situation, whether it's a fall or whatever. All right, so care for patients with coagulopathies. Emergency treatment. Take appropriate standard precautions. Perform a primary assessment and care for any immediate life threats. Obtain a history from the patient and identify which specific blood thinning medication he is taking or which bleeding disorder he suffers from. Notify the hospital as early as possible. So that's in our report. We let them know that they're on blood thinners, and if it's something bad we cannot control, we let them know even sooner, even before our report. Emergency treatment. Monitor the patient for the development of signs and symptoms of shock or decreasing mental status. Administer supplemental oxygen if the patient appears to be in shock or has decreased mental status, and transport to an appropriate receiving hospital. Anemia. Lack of normal amount of red blood cells in circulation. Acute anemia is a sudden blood loss. Chronic anemia. Recurrent heavy menstrual periods, slow gastrointestinal bleeding, diseases affecting bone marrow or the structure of hemoglobin. Sickle cell anemia. Genetic disease affecting RBCs. Most commonly occurs in patients of African descent. Defective shape resembling a sickle. Cells have a short lifespan leading to chronic anemia. Complications. Destruction of spleen, sickle pain crisis, acute chest syndrome, priapism, stroke, and jaundice. It is estimated that 1 in 13 African Americans has the sickle cell trait. Sickle cell trait doesn't always lead to complications. Possible to lead a normal life with the sickle cell trait. Sickle cell anemia. Administer supplemental oxygen. Monitor for inadequate respirations. Monitor for signs of hypoperfusion. Transport to stroke center if stroke is suspected. The renal system. So it has components: 2 kidneys, 2 ureters, 1 urethra. Kidneys are essential for life. They filter blood, remove certain waste products, excessive salts, and excessive fluids, and maintain fluid balance. Diseases of the renal systems. affect many different portions, range from minor to life-threatening. Urinary tract infections. Most common disease that affects the renal and urinary system. It's caused by bacteria, usually limited to the bladder, causes pain and frequent urination. If left untreated, can result in pyelonephritis, a UTI sends up the ureter into the kidney. Kidney stones, usually made of calcium and formed within the kidney. When in the kidney, they usually cause no symptoms. When they become dislodged, can cause severe unilateral flank pain. Patients may report nausea and vomiting. Patients with urinary catheters. The need for a urinary catheter, obstruction of bladder outflow, or a neurological disorder. These patients use urinary catheters to drain urine, commonly inserted in urethra, may be placed through skin. Complications of UTI and local trauma at site of catheter insertion. All right, renal failure. Occurs when kidneys lose ability to adequately filter and remove toxins. Acute failure typically results from shock or toxic ingestion. Chronic failure may be inherited or secondary to damage from uncontrolled diabetes or hypertension. End-stage renal disease, ESRD, irreversible renal failure, requires dialysis, hemodialysis, and perineal dialysis. 90% receive hemodialysis in specialized centers. Renal failure, vast majority of more than 450,000 Americans on dialysis who are treated in dialysis centers undergo 3 treatments a week, each lasting 3 to 4 hours. Only 8% treat themselves at home. ESRD patients often rely on EMS for transport to and from dialysis. Hemodialysis. Patient connected to a dialysis machine that pumps blood through specialized filters. 2 large catheters create a circuit by which blood is removed from the body, filtered, and returned to the body over several hours. Here's a diagram of what one looks like. You can check it out, and that way you kind of understand how one works, just so you have an idea. All right, 2 types of access to blood circulation. A 2-port catheter or AV fistula. Characteristic thrill when palpated. And here is a 2-port catheter, what they look like. And then here is a fistula, surgically connected an artery and vein in an extremity, and they are very noticeable from seeing one on somebody. It's not really a question if they have one. All right, peritoneal dialysis uses peritoneal cavities, large surface area, special fluid infused into abdominal cavity and left for several hours to absorb waste and excess fluid. Fluid is removed and discarded. Continuous ambulatory peritoneal dialysis, CAPD. Gravity exchange process repeated several times a day. Continuous cylinder-assisted peritoneal dialysis, CCPD. Machines used to fill and empty abdominal cavity while the person sleeps. Here is a picture of what it looks like. No fun. All right, medical emergencies in ESRD. Medical emergencies encountered with patients with ESRD can be broadly divided into 2 groups. Those that arise from loss of normal kidney functions and those that are complications of patients' dialysis treatment. Vast majority of dialysis patients have other underlying diseases such as diabetes and high blood pressure. Complications usually relate to patient missing dialysis, present with signs and symptoms similar to congestive heart failure, which is shortness of breath, edema, and an electrolyte imbalance. Caring for a patient who has missed dialysis. For the ESRD patient who has missed dialysis, assess the ABCs, obtain vital signs, place patient in position of comfort, administer oxygen, consider use of CPAP, monitor vital signs closely and have AED ready, transport to facility capable of dialysis. Complications: bleeding from the AV fistula site, clotting and loss of function of the AV fistula, bacterial infection due to contamination at the AV fistula or dialysis catheter site, and peritonitis. All right, care for patients. ESRD patients with complications of dialysis. Assess ABCs. Control bleeding. Use direct pressure evaluation and hemostatic dressings as needed. If bleeding cannot be controlled by other means, a tourniquet should be applied and administer oxygen. Treat for shock. Keep patient supine and warm. If peritonitis is suspected, transport dialysis fluid for confirmation. Kidney transplant patients. Kidneys are the most commonly transported organs, approximately 21,000 transplants per year. Patients spend their lives on a special class of drugs, helps prevent organ rejection, increase susceptibility of infections. Chapter review. Blood delivers oxygen to the cells, removes carbon dioxide from the cells, and controls bleeding by clotting. Blood consists of red blood cells, white blood cells, platelets, and plasma. Anemia is deficiency of red blood cells in circulation. Sickle cell anemia is an inherited disease in which a defect in the hemoglobin results in a sickle cell shape to red blood cells. This mishappening inhibits movement of red blood cells through capillaries, causing sludging and blockage in smaller vessels and causes chronic anemia. The renal system is comprised of kidneys, the ureters, the bladder, and the urethra. The kidneys perform a vital filtering of the blood to remove waste products. They also help maintain a water balance within the body. Problems with the renal system include infection, kidney stones, and renal failure. Renal failure is a condition in which the kidneys are unable to normally filter waste and provide a balance of fluids and electrolytes in the body. All right, dialysis removes excess fluid and electrolytes from the body by filtration. Dialysis may be performed in either two ways: hemodialysis or peritoneal dialysis. Hemodialysis at dialysis centers is generally performed 3 times per week. Peritoneal dialysis is done at home and usually done several times daily. Major complications in patients with end-stage renal disease can occur after the patient has missed dialysis appointments from infection or as a result of bleeding from hemodialysis access sites. Some things to remember. Blood has specific cellular components. Abnormal blood cells can significantly affect patients. The renal system is crucial to maintaining hemostasis. Renal failure can be chronic or acute. End-stage renal disease is managed through dialysis. And then some questions. Does my patient have a history of sickle cell disease or ESRD? Does my patient have an AV fistula? Will I need to make an early request for ALS because of complications from a missed dialysis appointment? All right, and then on critical thinking. You have a patient who is transported routinely for dialysis 3 times per week. She was sick and canceled the trip yesterday. Now she calls saying she can't breathe and feels like she's going to die. Is it possible that she has a legitimate complaint after missing dialysis by only 1 day? So remember what those causes can be, what it causes. It feels like CHF. So when you think about those, it kind of fits in there, right? So you get some vitals and go from there. Anyways, that is the end of this chapter.